Hello friends, today let us learn the anatomy of radius. You know the radius is a long bone. It is the lateral bone of the forearm. The forearm has got two bones, there is a lateral bone and medial bone. Radius is the lateral bone of the forearm. And being a long bone, it has got upper end, lower end and shaft. Okay, now let us see what are the features on the upper end of the radius. So here you are clearly seeing the upper end of the radius. The upper end of the radius has got a head, a neck and a tuberosity. This tuberosity is known as the radial tuberosity. Now, if you see the head of the radius is shaped like a disc. See the superior surface of the head of the radius, it has got a concavity. The concavity of the superior surface of the head of the radius is articulated with the rounded capitulum of the humerus. So we have already seen the humerus. So here we have the humerus. This is the capitulum. Okay. So this capitulum is articulated with the humerus. This is way and forms the humeroradial joint. The head has got a circumference. Okay. The circumference of the head medially articulates with the ulna. The medial part of the circumference of the head articulates with the ulna. So here I am having ulna. Ulna. So the medial aspect of the head of the radius is articulated with the ulna, and rest of the part is related to a ligament called annular ligament. Annular ligament. Constricted part below the head is known as the neck of the radius. Below the neck, we have the radial tuberosity. Remember, the radial tuberosity has got an anterior smooth part and posterior rough part. So here is a posterior rough part and anterior smooth part. The posterior rough part gives insertion to the tendon of biceps, whereas the anterior smooth part is related to a bursa. Now, the shaft has got three borders and three surfaces. The shaft has got three borders: anterior border, medial border and posterior border. Anterior border extends from the anterior aspect of the radial tuberosity, running downwards in the it extends up to the styloid process. Upper part of the anterior border, it is somewhat running obliquely, and this part is known as the anterior oblique line. Radial head of flexor digitorum superficialis muscle takes origin from this anterior oblique line, and its lower part of the anterior border gives attachment to flexor retinaculum. Posteriorly, it has got a posterior border. Posterior border is rounded somewhat. It is rounded and it is well demarcated in the midline. And in the upper part, we have posterior oblique line. And here is the medial border. Medial border is also known as the interosseous border. It extends from the radial tuberosity above to the posterior margin of the ulnar notch. If you see the lower end of radius, you can see a small notch. This notch is known as the ulnar notch, which articulates with the head of the ulna. The medial border extends from the radial tuberosity to the posterior border of the ulnar notch. The lower 3/4 of this medial border gives attachment to interosseous membrane. Here there is a triangular area. This triangular area gives attachment to deep fibers of pronator quadratus muscle. Three surfaces are there: anterior surface, lateral surface and posterior surface. Remember, this is the lateral bone. Okay, the lateral bone has got a lateral surface and a medial border. Okay, and ulna is a medial bone. So the medial bone has got medial surface and lateral border. Okay. Upper 3/4 of the anterior surface gives origin to flexor pollicis longus, and at the lower 1/4 we have pronator quadratus muscle is inserted. And here we have the posterior surface. At the middle 1/3 of the posterior surface, we have abductor pollicis longus muscle is attached. At the distal part, we have extensor pollicis longus muscle. Then here we have the lateral surface. At the upper 1/3 of the lateral surface, supinator muscle is inserted. And in the middle 1/3, pronator teres is inserted. And at the lower 1/3, extensor tendons are related. Now let us see the lower end of the radius. Lower end of the radius is widest part of the bone, and it has got five surfaces. It has got an anterior surface, then there is a posterior surface, then there is a medial surface, here is lateral surface and inferior surface. Anterior surface of the lower end of radius is a flat surface where the radial artery is related. So when we take the pulse, we can feel the radial artery over this area. Okay, so radial artery is related over the anterior surface of the lower end of radius. And if you see the posterior surface of the radius, there are four grooves for the extensor tendons. There is a prominent tubercle. This prominent tubercle is known as a dorsal tubercle of Lister. On the medial surface, there is a notch. That notch is known as the ulnar notch, where the head of the ulna is articulated. So I am having the ulna with me, and this is at the lower part end of the ulna. We have the head. Head of the ulna is articulated in this way. Here we have the lateral surface. The lateral surface is related to the tendons of abductor pollicis longus and extensor pollicis brevis, and the lateral surface is elongated downwards to form the styloid process. Just above the tip of the styloid process, so a muscle called brachioradialis muscle is inserted, and radial collateral ligament of the wrist is attached to the tip of the styloid process. Then we have inferior surface. The inferior surface of the lower end of radius, there is a quadrangular area and a triangular area. The scaphoid bone is articulated onto the triangular area, and the lunate bone is articulated onto the quadrangular area.